nurse tells me that she has taken your vitals and all your details down, so I don't need to do any of that. Have you had a cranial nerve exam before? Okay, so you know there's nothing scary about it. There's nothing that will be painful or even uncomfortable. It's just a few tests to make sure everything's working. Okay? So I'm just going to start by having a look at you, just examining your face, having a look at symmetry, just stuff like that. So if you could just look straight, straight at my nose, okay? Perfect. Everything looks good. I'm just going to come in a little bit closer, just have a look at your scalp there. Perfect. There doesn't seem to be anything concerning. Okay, and I'm just going to ask you to make a few facial expressions. Don't worry if you feel silly, I see this all every day. So I'm just going to ask you to smile as wide as you can. Okay, and then frown. Okay, perfect. And can you stick your tongue out? Okay, perfect. Let's take a note of these. Okay, and I'm just going to check the sensation in your face now by using a cotton bud. So nothing sharp or anything like that. I just want you to tell me when you feel the cotton bud just touching your face. Just say yes when you feel it, okay? And I want you to close your eyes while we're doing this so there's no cheating. Okay. Perfect. Okay. Yeah. Okay. Yep. Okay. Now the next one I'm going to do is a little bit trickier because I'm just going to be using a very wispy cotton bud, just like this. And I'm just going to be touching your face with the very end of it. And I want you to tell me when you feel that. Okay? Just the same as before, just say yes. Perfect. Okay. Sorry, it's a bit tickly. Perfect. Okay. Yeah. Okay. Perfect. Okay. Yeah. Okay, everything seems perfect there. Next, I'm just going to take a look at your ears, okay? You've not had any ear problems before, have you? No loss in hearing or anything like that? Okay. I'm just going to come a bit closer. Just have a look in your ears. Just in your right ear. And just first having a look. Just externally having a look. And there seems to be nothing wrong. Just inside. Okay. You've not had any pain or tenderness? No? Perfect. Okay. Everything looks fine with that ear. I'll just check your other one, okay? Okay. Again, the outside looks fine. fine. No problems there. And you've not had any pain or tenderness in this ear, have you? No, perfect. Again, internally I don't see anything immediately apparent, which is good. Okay. If you start to have any problems with your ears, strange sounds or pain or loss of hearing, I would recommend to book another appointment. Okay? But I cannot say anything immediately wrong. Okay? Look at that. Okay, I'm just gonna make sure that your hearing is fine as well. So to do that, I'm just gonna be rubbing my fingers together. And when you stop hearing my fingers rub together, I need you to tell me. Okay? Okay. Perfect. It's done this side. Okay. Yep. Seems perfectly normal there. Okay. Next, I'm going to take a look at your eyes. Again, you've not had any sight problems or pain or unusual redness. Okay, I'm just taking a look here. Yeah, there's nothing immediately wrong. Okay, you've not had any sight problems at all, just out of your usual vision. Okay, so I'm going to be doing a few little tests for your eyes. The first one is to do with your peripheral vision. So I'm going to be holding up a finger and slowly moving it out. And when you can no longer see it, you tell me, okay? Perfect. Okay. Yeah. Perfect. Okay. Yep. Okay. The next test is similar, but I'm just going to be holding my fingers in different positions, and occasionally I'll be waggling them. And when you see them waggle, you just got to tell me, okay? Yeah. Perfect. Okay. Yeah. Okay. Perfect. Okay, everything's perfect there. Okay, next I'm going to just examine your nose and do a couple tests on your sense of smell. Okay, so again, have you had any pain? And I'm just gonna go ahead and feel your sinuses here. Have you ever had any sinus infections in the past? Okay. I'm just gonna go up to your tear ducts. Okay. There doesn't seem to be any problems there. And I don't see any obvious abnormalities or anything like that. So next, I'm going to be testing your sense of smell. I have a couple droppers here with different scents in them, and I want you to identify what scents they are. Okay? And don't worry, none of them are unpleasant. They should all be familiar to you. Okay, here's the first one. What can you smell? Mint. Perfect. Yep. It smells like toothpaste. Here's the next scent, slightly trickier. It's familiar. Vanilla, yeah. Perfect. Okay, and your last one. Can you smell? Strawberry. Perfect. Yes, you aced that one. Okay. And lastly, I'm going to be examining your neck and your throat, just having a little feel of your lymph nodes. Okay, so can you lift your chin up? Perfect. Okay. Now I just want you to tell me, as I press just down the sides, if you have any tenderness or pain, anything like that. Okay. No pain. Perfect. Okay. And I don't feel any swelling or anything like that. Okay. Perfect. Next, I'm just going to be very lightly pressing on your trachea. And you just tell me if there's any tender spots. Okay. Just keep your head lifted. Perfect. Okay. I don't feel anything. You don't have any pain, do you? Okay. That's perfect. Just turn your head to this side. Okay. And then just turn your head to the other side. Okay, that's perfect. No, I don't see anything worrying or anything like that. Perfect. Okay, you can just relax. We've finished all the tests now and everything came back really positively. Yeah, I don't see that you have any problems here. Okay, but if you do feel in the future, if you have anything you're worried about or you want to come in for another checkup, just give me a call, okay, and we can arrange an appointment. Thank you very much. Okay, enjoy the rest of your day.